Welcome to the Rutgers Community Living Education Project's Sharing Possibilities for Community Connections learning event. The Rutgers Community Living Education Project, also known as CLEP, is a program through Rutgers School of Public Health. CLEP is committed to providing individual guidance, mentoring, and education regarding community living resources for people with intellectual and developmental disabilities. The CLEP team, many who are family members themselves, can serve as a bridge for families whose loved ones may be seeking residential supports outside of the family's home. Today's webinar, Fostering Positive and Informed Relationships Between Police, Fire, and Community Medical Support for Individuals with Autism, is being presented by Dr. Bianca Coleman, representing Behavior Therapy Associates. To assure the highest sound quality possible, all attendees will be muted during today's event. To interact with the host and presenter, please use your Q&A option on the screen. Topic-specific questions will be addressed as long as time allows. For consideration to all of our attendees, we encourage you to keep your questions as general as possible. A copy of today's PowerPoint will be shared in the chat section shortly. At this time, I would like to welcome today's presenter, Dr. Bianca Coleman. Dr. Coleman, welcome.
Thank you so much, Melanie. I appreciate the opportunity to be able to speak with everyone on this topic. I feel like this is both a relevant and important topic to continue to revisit as things grow and change and evolve with our society, with our instructional strategies that we have available, with our technological supports that we have available. So good afternoon and welcome. Thank you so much. I'm going to start out our talk by going over an overview of what we will be discussing throughout the rest of this hour. As Melanie had mentioned, we'll handle questions at the end, but if there is anything that's pressing that you want to make sure that we do cover, you can go ahead and enter that into the chat, and I'll be sure to revisit those topics at the end. We're going to start by first discussing both the importance and the needs of this area. We're going to be talking about building awareness and forming partnerships for both in a reciprocal way for families and for the first responders. I'm going to be going over some specific challenges that individuals with ASD may encounter when working with first responders and vice versa. We're going to be talking about some preparation strategies, thinking outside of that initial preparation phase. I want to make sure that I'm providing you with some specific examples for how to share information, how to provide instruction, how to ensure that a very clear, salient message is being put across on both ends. And then we're going to be going into some additional areas for consideration. I hope that this topic is relevant for both families and first responders, but because our audience, I believe, is consisting of a lot of professionals in the field, I also want to make sure that I'm directing supports and really good practical out-of-the-gate strategies for you to implement with clients and families that you're working with currently. First, we're going to discuss the areas of need. As I mentioned at the top of our discussion, there is, really a great need to have continued conversations in this area. As a result of some increased risks associated with interactions with individuals who may present with autism spectrum disorder, and then corresponding interactions that they might have within the community at periods of heightened emotional states, crises, environmental catastrophes, health and safety issues. We're going to make sure that we're really taking the time to identify the challenges and then pinpoint some strategies as to how we can address those moving forward. I have a background in both psychology and behavior analysis, so a lot of the strategies that I'm going to be talking about will be coming from both places with some behavior analytic underpinnings for instruction. So first and foremost, let's discuss some of the challenges associated with the dangerous scenarios from the point of view of the individual with autism. So at this time, as I had mentioned, there might be some heightened emotional states. And with individuals with autism spectrum disorder, those heightened emotional states can also come with the potential for some dangerous behaviors to occur. In both recognizing the dangerous scenarios, failure to be able to identify dangerous scenarios, and engagement in some difficult behaviors such as elopement, aggression, or any type of other heightened behavior that might occur at a period of time in which the individual is feeling very emotional or dysregulated or upset. We want to make sure that we're identifying with the individuals who we are working with the individuals in our family, and with the individuals in our community, the potential for these behaviors to be occurring. So specifically, again, I'm talking about things like aggression, elopement, self-injury, pica, really challenges in coping strategies and being able to implement coping strategies independently when involved in a very heightened emotional state or a crisis event. There could also be some other present behaviors that might set the individual at a higher risk for a dangerous situation to occur. Of course, we think of things like elopement, but however, there are also areas of difficulty involving feeding, which might result in some choking risks, fine and gross motor challenges, which might impair balance or coordination difficulties, comorbid medical issues, seizures, difficulty understanding consequences and their interaction with the environment. And then also certain behaviors that might place them at greater risk, such as self-injurious behavior, such as self-stimulatory behavior. These behaviors could be misinterpreted by individuals as combative, individuals who are maybe not as familiar with that person on the spectrum. So we want to make sure that we're identifying these areas and then working through each of these specific areas of concern when considering some of the additional strategies that I'm going to be talking about today. In terms of first responder training, oftentimes we're seeing training being provided in a very generalized or topical way. So first responders don't often have a lot of that deeper knowledge and insight into some of these challenging behaviors which I've spoken about. There's also not often a great amount of conversation being had with regard to individuals who are at different levels of functioning. So when they're receiving that training regarding interaction with autism individuals on the spectrum, they might not be getting enough information on either end. You know, how to interact is going to be very different across the spectrum. Potential challenges that are going to be faced in the moment is that, again, we're having these challenges not at a calm time when there's a chance for rapport building, when there's a chance for allowing additional support staff or additional family members to come in and help with the interaction. This is a very time-sensitive period that comes at an emergent situation. There's also going to be the potential for some significant communication difficulties, difficulties from both ends. Challenges with the individual with ASD could consist of difficulty with expressive communication, difficulty with receptive communication, and challenges on the part of the first responder might be using very difficult to understand language that's coming in at hurried pace or at a volume in which the individual is really struggling to cope with in the moment. Also, ambient noise, which might come along with a crisis event, could be very disturbing to the communication experience also. We're also working in a situation where there's a lot of novel people, there's a lot of novel scenarios, and the setting itself could be something that is both challenging and different for an individual on the spectrum. So we want to take note of that as well. And I want to make sure that when we're having these discussions, we're thinking beyond the police, fire, and EMS personnel. We're also thinking about county law enforcement. We're thinking about military personnel. We're thinking about safety resource officers in the school setting or in the work setting where your loved one, where your client, where your community member might be at that time. So I want to make sure that we're making sure to generalize these strategies across all providers. The next topic for discussion I want to make sure we delve into first at the height of this discussion is going to be talking about building awareness. I want to break our talk down into talking about strategies for the individual and the family, and then also from the first responders perspective as well too. So I'm not sure how many first responders we have in the audience today, but as professionals who are interacting with individuals and families on the spectrum, I want to make sure that we're then transferring some of this information to them if they're not present in mass. So as far as individuals and families are concerned, these areas are going to be talking about how we can build and sustain meaningful awareness. That's first going to come with sharing information about the individual. This can happen in a variety of different ways. One of the most straightforward methods, and I'm going to share a couple of examples, is going to be presenting a very concrete, very straightforward information form. This abilities form can look a little bit different depending on where you're receiving it from or where you're using it. I encourage families and providers to really personalize the information that is being shared towards what's pertinent to the individual. Some first responders have their own forms for completion, but I encourage you to take it a step further and provide some additional information. So that information can consist of method of communication, tips for communication, preferences for the individual. So that can be touch, sound, interaction style, anything that you feel like could be helpful. An up-to-date picture is going to be one of the most important things that you're providing. Sometimes we feel like we get this information in and it's done, but it's important, especially if you have a child versus an adult, to make sure that that picture is current and shows the state of what their hair looks like, what their facial hair looks like, what their body looks like, so that all individuals are familiar with your child, as much as possible. Important contact information. This can include both the familiar caregivers or the people that the individual is most comfortable with. Can also be a doctor or a professional who has been working with the individual and can be helpful in these times of stress. And then I would also make sure to include on this form any information about comfortable places, familiar places, where the individual may go if an elopement does occur, if a wandering does happen, or if the individual becomes stressed and upset, where would they go to seek comfort? So any of that information is going to be really helpful. Taking it a step further, also ensuring that the individual with whom you work or the individual in your family and the family members are taking time to really visit the first responders and the different locations. Becoming familiar with the people, the sounds, how they look, how they talk, how they interact, and that label of this is a police officer, this is their outfit, this is their things that you're going to see when you interact with them. And then it also allows an opportunity for the individual to become familiar with some of those faces that they might encounter more often. So for police and fire, that might be targeting officers who are more likely to respond to emergency calls, or a familiar patrolman in the area. And for EMS, that might be individuals who are more currently on a faster rotation of their schedules, so they might be on calls more often. Again, just associating a face, a name, a label is going to increase that comfort on the front end as an antecedent intervention to ensure that the individuals are comfortable in the moment. And then I'm going to be talking a little bit more in depth about this, but I want to make sure that in terms of awareness, that we're really teaching the skills and familiarizing the individual with what to expect, especially given novel interactions and novel people that they might encounter. And this is the frequency in which this occurs is going to be very important as well. So here I've provided you with just a sample of one of the types of information forms that can be used. This one, as you can see, front and center is a picture of the child. This is something that goes a little bit more into, hobbies and interests, things like that. you can feel free to include some of this information as well too. It might be helpful for the first responders to at least be familiar with the individual and what they might be interested in the moment that they might have to de-escalate or redirect or assist them by perhaps talking about a topic of high interest. You don't necessarily have to go into this amount of depth, but this is just one sample that I thought might be helpful. You can also include on there some things such as communication strategies. Some of those, I would limit it to one page, just a super quick overview, but some emergency numbers and some strategies in the moment for de-escalation might be helpful. This is an example of another form that's commonly being used or can be used. This is a bit more straightforward, and depending to who you are providing this to, this might be more appropriate. I would think that, again, taking a look at the different options available and what kind of information you feel is the most pertinent and relevant for the individual with whom you are advocating for or working with, you can choose from any of these information also. Here's another example too. The one on the left is going to be something that you can consider for an identification card. Oftentimes, and I'll talk about this throughout our discussion, oftentimes an identification card is something that is very helpful in the moment to have on the individual to make sure that there is a straightforward way to identify and provide information. This can be something that you are working on with instruction and rehearsal to present this card. This can be something that is on the information form about your child. There is an information card that presents some helpful tips and strategies or some relevant information on the person at all times. And then the one on the right is an additional card that you can provide as well too in a high visibility area, such as around the neck on a lanyard if you're out in the community, or if there is you know, an environmental event or the potential for a dangerous situation, you can make sure that that is on the individual at all times. Oops. And this is another information form. Again, you can see the differences in the format, the information that is provided. I have a link at the end of the presentation for a hub where all of these forms via the Children's Specialized Hospital will be. And then I'll also share some other information about that resource at the end as well too. But this is just another great example. Part 2 of that. Okay, so continuing on our talk about building awareness when it comes to the individual and the family, I think that it's going to also be important as we're working on education and introduction of these concepts to collaborate and ensure that the school or the educational or the work setting is involved on providing instruction and possible assistance as well. This can come in the form of very directed IEP goals and objectives. This can come in the form of events at the school that might involve community and safety. Again, we know, you know, professionals in the community, you know that the more often this information is presented, discussed, reviewed, the more likely things are to generalize and become part of the individual's repertoire. So I want to encourage active involvement with the school, with the work setting, with the community, and safety personnel as well. And this can also come in the form of parent advocacy, partnering with the school, with the day program, with the vocational setting, with the group home to help inform the areas of need when it comes to their individual, their child, that they are familiar with. So this will help identify the need, and as well as potential outreach opportunities. So the family might be aware of additional activities that are present within the community, or might have a connection to a first responder or a coalition, or might be part of a board. So making sure that this information is shared between the school setting or the educational setting and the family is going to be a really important and wonderful opportunity for further collaboration and involvement from first responders. And then in terms of the individual and family, I also want to make sure that we discuss self-advocacy. So for individuals on the spectrum who are older, who are able, who have the abilities to do so, it's important to be able to self-advocate. So having individuals with ASD be a part of this discussion. What are they comfortable with? What are they uncomfortable with? What questions do they have? That's going to be a great way to ensure that they are brought into the discussion, they are able to provide meaningful feedback, and they're comfortable with the steps moving forward. In the same vein, making sure that you're having discussions with the individual about self-management skills. What's preferable in terms of de-escalation methods, self-regulation strategies. If they're anticipating a challenging situation, how do they feel about that? What concerns do they have about that moving forward? This self-advocacy is also going to thread into some additional discussion that I want to make sure that we have regarding the individuals on the spectrum to be able to talk to first responders, to be able to inform them, enlighten them, train them on what is helpful, what is not helpful in the moment. Again, having a well-integrated kind of community aspect here is going to help with things in the event of a crisis event. Right, so moving into the steps for the first responders in terms of awareness, I'm going to circle back to that community awareness and take it from their perspective. So for individuals who are first responders, this is going to be about really immersing themselves into the neurodivergent community, into the disabilities community at a deeper level. So even though we're going to be talking about gathering and sharing info, it's the manner in which that it's done, I feel, is really important. First, becoming familiar with settings in which there are individuals on the spectrum, specifically with regard to this talk, or individuals with disabilities. Oops, sorry about that. Such as schools, specialized programs, day programs, shelters, just becoming familiar with the location and the population within each one of these settings. It's going to be very important to kind of cueing in where should be the most focused amount of effort into that, putting a face to the name type of approach. There's going to be different opportunities that are going to be available in all of these settings for participation in activities, learning programs, things like that. But something as simple as being a volunteer in a setting, for instance, in a group home, should be a very nice way to bridge that gap and make an interaction more comfortable, familiarize the individual with first responders who they might be having more interaction periods with, and things of that nature. There's also, I know there's a lot that are kind of sporadically implemented, but I encourage school districts, I encourage programs anywhere to incorporate awareness days where they're welcoming in individuals within the community who may be first responders or have frequent interactions with their loved one, with their person with whom they're providing assistance to be able to kind of share in information, resources, and just general interactions in a far more relaxed and more frequent setting. I would encourage members of the community to look into first responder sponsored events and partnerships, and encouraging, if you're a parent, encouraging your child or your loved one's programming to participate in these, or vice versa. For first responders, I would also encourage frequent surveying of the community itself for interest, for whether or not they would like for you to come and share information. This will also allow opportunities for the distribution of information forms. In terms of the information forms, I know that some first responders do have access to these. They are generic, but I would also encourage, if there is any first responders in this audience, to consider what additions to the forms you already have would be helpful. Distribution of these forms would allow the families for an opportunity to be able to provide the information to you if they don't have the resources or the knowledge to be able to find these forms that I've shared on their own. So distribution of these forms is going to be important. When they come back, when the forms come back to the agencies, it's also going to be important to decide how to disseminate that information to the group as a whole. So I encourage additional conversations to occur as to how this information can be shared and how it can be easily on hand and accessible during emergent situations. In terms of instruction directly for preparedness, I want to speak first to kind of the level of concern, the prioritized items first here. I really feel as though it's often a misstep, just because of the amount of goals, the amount of abilities, the amount of behaviors that are targeted for an individual in the spectrum. It's often a misstep, and things such as ensuring that general foundational knowledge is mastered first is often kind of overlooked. So some of the first steps that I feel as though are going to be important to make sure that the individual with whom you're working or your family member really has down very solidly: name, address, phone number, disability information. These things you want to make sure are generalizable and are able to be expressed comfortably and easily outside of mom and dad, outside of provider, having this information being tested out in the community. So let's just make sure that this information is not only maintained, but generalized as well across settings and people. For nonverbal individuals, I want to make sure that we are targeting information and how to share information in this same vein. Things like an identification card, identifying where information might be found if it's not able to be readily expressed. Things like showing an identification bracelet. So skills that they might not be able to verbally express, but nonverbal strategies should also be as part of the curriculum as early as possible. And again, generalized, trialed in multiple settings at multiple times with different individuals. Identifying first responders, who they are and what they do. This is something I see in a lot of programs for our younger individuals, but I'm not sure the extent to which we're really continuing that throughout the age, throughout the variety of different ages is really occurring. So identifying who police officers are and what they do, who firefighters are and what they do in a variety of different settings is going to be very, very important here. I would utilize real pictures to the greatest extent possible. So again, during those times in which you are spreading that awareness and having your child interact with individuals who are first responders, taking pictures with that person, labeling a name, things like that are going to be helpful to make sure that in the moment these skills are maintained. And then going forward and rehearsing and labeling in the environment after that is also a key strategy here. So this instruction specifically should occur via a variety of different ways. And, depending on what your individual is most comfortable with, what abilities are able to be utilized in that moment, I would explore a variety of different options. Things like role play and rehearsal are often really helpful to model the interaction as a whole versus just the skill in isolation. Referring to videos to expose the individuals to sounds and sights is going to be a really important strategy to getting through some of that initial anxiety and potential escalation that could occur as a result of being thrust into this novel environment. Social stories are also a great way to introduce concepts such as dangerous situations, rules and guidelines for interaction and things of that nature. They can be easily rehearsed. And then I also want to be able to speak a little bit to some advances in technology that I have been able to learn about here. So there are some VR experiences, some virtual reality experiences that are currently being evaluated in literature for utility. The content and making sure they're specifically tailored to individuals with ASD is also being further evaluated as well. This is an assistive tool that I know is being utilized at the Children's Specialized Hospital as a part of a safety and education grant that has been received. So I encourage parents and providers to look into what options in your area, what options are available for continuing this exposure, this pre-exposure and practice that should accompany the instruction of these foundational concepts. Having an individual be familiar with the sounds, the sights, and then even the smells. If you're, out in an area where there is a fire within a safe distance away, identifying and labeling, this is what that smells like. This is what, this is a dangerous situation, and really being able to talk through things in that moment, identifying things in the context of fire safety in a dangerous situation is going to be key to ensuring that this foundational knowledge is instilled. I would also take the time, via video modeling or via time with the first responders themselves to help the individual become more familiarized with some key phrases that might be used. There are statements that are made initially upon meeting individuals. There are identifying labels or terms that are frequently used by first responders that your child, that your individual, that your client might be unfamiliar with, and that they should be exposed to as well too. An additional strategy, an additional measure for the family and for the individual that will be helpful is to be able to identify safe spaces and places in novel environments for the individual to be able to go to immediately. Somewhere where is more comfortable, somewhere that is further away from the dangerous situation. When I speak about this, I'm mainly speaking about outside of the home setting. So identifying when you are on vacation, when you are in a home, when you are in the community in a novel building, identifying routes for evacuation, identifying an area that might be more out of the way, less exposed to potential threat, and just having that discussion ahead of time when you're visiting that location, or if it's a novel setting like a vacation, just rehearsing it and going through it a couple times to the individual upon arrival. Through this frequent discussion and practice, again, we hope to really be able to increase the comfort level, to be able to implement some of these antecedent strategies to ensure that the interaction is as safe and as stress-free as possible, even though we recognize in a crisis event that this might not be the case. These preparation strategies are at least a step in the direction to be able to ensure safety to some degree. So I've also included a couple options as far as ways to kind of discuss these safe places and safe options. So having something that you're developing as a family or during programming that discusses a fire evacuation route, where to go, what to do in the event of a fire, for instance, in the home. This is another form provided by Children's Specialized Hospital that allows for a route to be drawn. Again, depending on the individual, this may or may not be appropriate, but using pictures, using visuals to support the discussion is often helpful. And the degree to which you can form a route and rehearse that route several times is going to be very helpful in the moment. Continuing the discussion, in terms of preparation for first responders, there's a few things that I feel like can be discussed a bit further that go beyond the traditional kind of what to do in the moment steps. One of those is the consideration of the development of training videos. There are some out there, and there are certainly some really fabulous professionals, but for your community, you might require something a little bit additional depending on the population that exists. And some additional strategies within videos could also be helpful for families. This video would allow for the families to be able to rehearse, to review in that comfortable setting at home frequently, and would also allow for important messages to be disseminated from the first responder community to the families themselves. Some important things to include in these videos would be some familiar faces and labels, the common language, the examples being used, the extent to which you can provide an in-the-moment type of discussion. So during an actual safety event or practice crisis event, you can often walk through the steps that might occur. That could be an option for what to include. Showing the locations of the buildings where to go if assistance is needed. Some families and individuals aren't able to be into the community often for reasons of resources or safety concerns in general with regard to the individual. So having that available to look at frequently could be a helpful strategy. Some do's and don'ts in the moments for families. What is helpful for the first responders to have and what is helpful for them to know? This can also be disseminated via this video. And then what to expect during different situations. The first responders may also choose to provide samples or templates of different types of identification cards. As I mentioned, some agencies have forms that they like to use to be able to identify individuals who are on the spectrum or who might have greater needs. However, providing some additional options for identification could also be helpful for families who might not be able to access those resources. As providers or professionals in the community, in the behavior community, in the psychological community, these can also be things that you are working with first responders to develop. And then as a provider to be able to show some families some examples of some of these as well. For first responders specifically, it's important to be able to identify specialists or have more point people within the department itself. This might require some designation of a team of specialist individuals who have more in-depth knowledge of the individuals in the community, perhaps, or are more well-versed or specifically trained in de-escalation methods. Depending on your area where you are, there might be specific mandates for training that has to occur. But for first responders, I encourage you to have more specialized groups within your organization to be able to provide more assistance in this area beyond the general training. These individuals should be, of course, represented at community events and can serve as liaisons between the department and the community. And it just allows for more of a focused and continued discussion on the areas of need. And then in terms of training, again, as I mentioned, there are some very broad-based and general interaction de-escalation trainings. However, as departments are concerned, or as a family member or an advocate, ensuring that your first responders have more specific training with regard to individuals with ASD, with regard to individuals who might be at a similar functioning level as your loved one or as your client, is very important. So familiarity of the entire spectrum. What does a more communication impaired individual look like, function like, in terms of their interaction style? That's going to be very important and very helpful. Individuals who are on the higher functioning end, but who have difficulty on the pressure spots, social interactions, or might display some more milder forms that might be misinterpreted. What does that look like? How are they identifying themselves? Things of that nature. And then communication training specifically. When working with individuals on the spectrum, what are appropriate training, or what are appropriate communication methods that should be utilized? Things like awareness of body language, things like tone and volume of voice. Also allowing an opportunity for the individual to respond. Having patience in the moment is going to be very difficult by nature of the situation. However, taking the time for additional think time or response time can often be key in ensuring a more fluid interaction and more helpful for the individual. This is an additional form. So throughout the presentation, I want to make sure I'm kind of interjecting some like real life examples for you of some safety information forms. This is the type of intervention that, or I'm sorry, the type of form that is more helpful for emergency medical services. So this, as you can see, also does discuss their medical needs, but then sensory challenges. To what degree do they require specific assistance, other modes of communication? All these things are going to be very important, but you might want to have something more specific for the different branches of first responders. So in general, tips and interaction guidelines for both families, individuals, families and individuals and first responders should be more geared towards ensuring that Specific things are done in advance with regard to training, as I mentioned, with regard to tone of voice and body language and proximity. First responders, just being aware of your touch, how you are interacting with that person physically. What does their response look like when you are touching them? That will help guide the interaction in the moment. Backing off when you're seeing that a large physical presence is overwhelming for that individual, or providing a little bit of space initially and then slowly meeting the individual where they are to ensure that they're continuing to be comfortable with the interaction style. Things like expression are often very meaningful, depending on the first responder. If there is a helmet, if there is a hat, making sure that your expression can be fully visible to the individual on the spectrum. And then for families and professionals, the degree to which you can show and familiarize the individual with what a provider looks like with a helmet on or with a hat on, with different types of clothing on, so that they are, again, more comfortable with the in the moment geared up type of person, and then the interaction in the community person as well too. Some other strategies that are helpful for first responders include repeating directions. So instead of saying things first and expecting an immediate response, allowing that extra think time, then repeating, using very concrete, simplified language. Those of us who are familiar with working directly with individuals with ASD, using a lot of over talking or over explanation, we know isn't always helpful, isn't always relevant, and can sometimes escalate a person who is already uncomfortable or anxious. So using very simplified and concrete language is important. For first responders, making sure that you are introducing yourself with your job title embedded. I've provided an example there. That'll help cue that previously taught knowledge to be able to enter into the situation with a little bit of extra help and prompting. As far as the department is concerned, I think it's also helpful to have a kit or resources available to the first responders in the moment. Now, as a parent, as an advocate, or as an individual with ASD who is an advocate for yourself, this might be an important discussion to have. What does that information look like that is shared with that is provided initially, right? So when they have the surveys that come in from the community, when you provide that general information about me sheet, where does that go? How is that stored? It could also be very helpful in the moment to have that available. So in vehicles, or having, if there is perhaps a kit that's in a vehicle already, having the individuals identified on a piece of paper in a binder and available is oftentimes going to be more of a support strategy in the moment for that first responder. We certainly can't expect everyone to be known at every time, but if you have that information that you can go back to quickly in the moment and review, that could also be very helpful. Considering that specific response team that we discussed earlier, or identify personnel, having them present at the time of the interaction, if possible. I realize that might not always be the case, but in the moment, if you can identify one person to speak directly to the individual and have a majority of the interaction, that in itself will be less overwhelming. If we're switching people off and on, multiply interacting with the individual, or if there are too many people present and talking all at once, that can be an overwhelming experience. I would encourage continued structured training with multiple examples, as I had mentioned before, making sure that there is exposure to individuals across the spectrum, that they have the opportunity to collaborate with individuals on the spectrum and their families and their providers, and the extent to which that can be repeated beyond the annual training is going to be helpful in continuing to foster these interventions. Just do a quick time check here. I want to make sure I allow enough time for questions. I want to consider just going a bit further and just speaking very generally to all attendees about what other strategies we can do, how we can further support this process. and this is really going to be through, repeated exposure and practice at the very least. With regard to safety drills, individuals who are in more of the school-based setting have more exposure to safety drills, but these are all often, very brief, very general. I want to make sure that we are encouraging safety drills and practicing the skills that we've taught with that foundational knowledge training to be completed in homes as well. Similarly, vocational settings and group homes, role playing through in this safety drill type format could also be very helpful to ensuring that the individuals remain comfortable with the interaction and have continued knowledge of the expectations in the moment. In the home setting, it is often part of this antecedent intervention process here is going to be making sure that we're reviewing safety issues that might occur in the home as well. Preventing dangerous events in the home will limit the interaction with first responders in an ideal scenario. So just as a family, becoming aware of potential safety issues in the home that might involve toxic materials, sharps, for areas around water, drowning, dangerous furniture, elopement, and leaving areas, things like that, ensuring that if these are identified areas of concern, that they are being worked through and strategies are being developed as to how to prevent those. Environmental strategies are being put in place as how to kind of minimize the risk or the exposure. I've put a couple links here as to how to continue to look in on this and ensure that we are being safe in the home and how to kind of prevent some of these issues in the home setting. So they're there for your consideration. Additional considerations for home and programs and group home settings would be considering what technology is out there and available with regard to specialized alarms and safety materials. There are alarms that, for instance, instead of having one loud general noise, will repeat directions out loud. There are different types of alerts that are available that can be placed in different areas in the homes. There are, of course, a variety of different safety measures and locks to be put on doors for individuals who might have more elopement concerns. So a lot of those products and things are kind of spread out through the internet. So I'm trying to provide you with some direct links for you to consider some of these options. And certainly, advancements are made all the time with regard to this type of technology. So it's important to be able to understand and know what options are available for you. And I want to encourage you to explore these options. However, products should be a part of a multifaceted safety plan. A product is not going to be the be all end all. It certainly will give peace of mind to some degree, but it's important to remember to continue to teach some of these foundational concepts that I've discussed and continue to practice and go through and role play in the moment. It's all part of this bigger plan, and one I want to make sure that we are continuing to visit. With regard to elopement, this is something that I have encountered often as, a primary source of concern for some families. It occurs to an exponentially higher degree with individuals on the spectrum. So having an appropriate elopement response plan is going to be very important, not just in those cases, but in any case when you have an individual who may not be able to advocate for themselves in the moment, who might not have good consequence knowledge and understanding of the consequences of their actions, and who might be at higher risk in general. So I've linked up an elopement response plan. This is something that you can keep for your family and programming, but is also something that should be shared with first responders, including information, like I discussed earlier, that would be important and helpful for them. Where would that individual go? What do they like to do? What might they be seeking? Where are they familiar with in the community within walking distance that might be somewhere that they would go? So here I'm wrapping up here, and I want to talk about a couple more options for consideration, things that are going to be important in moving beyond this conversation. As a family, as a provider, it's important to have discussions about which identification strategy or tool is going to be most appropriate for the individual. When possible, having discussions with the individual about what they are the most comfortable with, what is easiest for them to access. And these might consist of a medical ID, a medical bracelet, an ID card, clothing labels. So my point here is that it doesn't matter. Yeah, it matters for the individual what you're using, but to any degree, this should be something that any family is making sure is in place. Any provider is ensuring is part of the family's discussion and safety measures moving forward. Additional training for caregivers or support staff for providing assistance during emergencies is an area that there is not a lot of research and attention to, and I feel as though there should be some additional time and commitment made to these. So we are familiar with the day-to-day interactions, periods of escalation, but there are certain types of things that may occur within the context of larger emergencies that might be important to have continuing conversations about with families. There might need to be some specific training. There might need to be some specific intervention strategies that are more appropriate for just that period. And since that is hopefully a lesser encountered scenario, just becoming familiar with and rehearsing as a collaborative care group will be helpful for ensuring everyone feels prepared in the moment. This could also occur with discussions around what you would need in an emergent situation with this individual. Is there a kit that would have perhaps some sensory limiting strategies like headphones or glasses that would be helpful for the individual? Is there perhaps some self-soothing or de-escalation tools or items or fidgets or something that is helpful for that individual to have? That could also be a part of the discussion. Where will they be located? Are they easily accessible? Can we grab it and go? All of those conversations are helpful to have in advance. For professionals who are joining me today, I think it's important to become familiar with the steps that might be necessary to become a trainer. So a lot of this information that I'm sharing with you today is open and readily available to anyone to view. However, being able to have that disseminated in a manner in which will be salient and helpful to families, not overwhelming, might rest on the shoulders of our providers. So I encourage you to look into steps to become a trainer or putting together a packet of information for families that you work with or for schools and group homes, having discussions about this on a larger scale and informing and being a point person to be able to disseminate this information. It's also important for our providers, for our behavior analysts, for our psychologists, for our school staff, for our CST members, to identify local areas of need for this and advocating for the individuals in your community to receive more supports in this area, more visits, more interactions, more education, more targeted goals. So becoming an advocate for that. And in the same vein, being able to come up with wonderful, measurable goals to support this for our individuals who might be in supported work programs, in educational programmings that have targeted goals, to ensure that this is part of their educational process as well. And then, as I mentioned here as the last bullet point, the comfort kits. These are helpful in case of any type of emergency, and keeping something in the car is just as helpful as keeping something in the home, and then ensuring while away from your home and on vacation that there are comfort materials available beyond what you would typically have on hand, just in case of an emergent situation. I want to wrap up our discussion by going back and taking a look at a few key concepts and ensuring that I'm giving you some great takeaways from this. So first and foremost, I know I've talked about this a bit in terms of the training, but ensuring that the generalization of the skills outside of the home is occurring. This is both the responsibility of the family and the provider that may be involved with the family, and the school setting as well. So ensuring that there is a level of familiarity outside of the sessions, outside of the educational setting, outside of just working with mom and dad. For the families, it's important to keep all shared information up to date. The information forms that you're sharing, the pictures, things like that need to be updated routinely. I would schedule visits and tours every so often to continue to ensure that the individual remains comfortable in the setting, is able to locate areas where first responders might be present, and is familiar with those sights, sounds, and smells. Frequent discussion and role play and just general, identification of things in the community is going to be instrumental to ensuring that generalization occurs. Families and providers, I would also encourage you to explore the novel technological options available, including some of the methods of exposure that I had mentioned, including virtual reality and augmented reality challenge information. And then, of course, any discussion that, I'm having in these areas, I want to make sure that I encourage the continued collaboration with the community and the community partnership. Safety skills and familiarity with first responders doesn't happen in isolation. It's going to take work from all sides. So ensuring that collaboration remains open and that our advocates continue to remain involved in both of these settings will be key moving forward. As promised, I wanted to link up some of the resources that I shared with you today. The first is the Living Safely initiative by Children's Specialized Hospital, who's responsible for a good amount of these forms that I had shown. There will be a hub available that will be live in June that will have a lot of these, if not all of these resources, easily accessible there. So I encourage you to look at that specifically. In terms of other options for training and advocacy, I've linked some direct providers there too. These individuals are listed to be available for schools, for families, for programming situations, to be able to provide specific instruction and assistance. And then for first responders, specific training options as well too. I've also linked some other areas in which you can consider some tips for just general interaction in the community. There's some specific links with law enforcement there too. And then being admitted to the hospital. So taking it a step further, I continue to kind of explore these options myself. So I would encourage you to do so as well. There's some other links here that I've put for, templates for plans and resources, materials, and they'll all be available on my presentation. So I'd like to open up the option for some questions.
Dr. Coleman, thank you so much. I think all the information that you were able to share today was really, you give a lot of useful suggestions for advocates, family members, and professionals alike to really explore independently, right, with the people that they're supporting, to see what pieces of this is going to work for them. So greatly appreciate all the suggestions and education that you provided today. We do have a few questions coming in. We actually have attendees sharing some resources also, which I shared in that section. So that's great, right? Quite often it's families helping families or professionals helping professionals that really allow us to gain more resources throughout our lives. So thank you. So the first question is, if the person with a disability lives in a group home, who should be reaching out to the community/county for improving communication to the residents?
So I think that can really fall on the part of, anyone involved in the situation. The agency who is providing the service within the group home, I encourage advocates and family members to reach out again and see what resources are available within the community to be able to share in that setting. Oftentimes providers are welcoming of any suggestions for services, for trainings, for materials. So, and we are all, it is impossible for everyone to have access to everything. So I encourage involvement, across the board.
Perfect. I think just from personal experience, I know that when my son was not able to communicate his needs at one point in his life, we did actually keep that envelope in a car marked emergency on it. We did have an identification bracelet on him marked with some of his needs. We also actually reached out to some of the emergency response personnel in our town and shared a one-page profile and also met with them independently. They were even willing to come to our house and meet with him outside of an emergency so that they were more familiar with his needs and how to best approach certain situations, right? No sirens, no lights, for example. But also I think it allowed my son to be more comfortable with them when they did have to come into the home during an emergency. It allowed the whole situation, I think, to be more comfortable for everyone involved, which was great. And again, it allowed my son to introduce himself to the professionals in a way that he was comfortable. So great suggestions that you've made. Our next question is, it's more of a comment. I'm sure that your team already knows this, but this webinar would be excellent for anyone with a disability who has challenges when communicating, especially for mental health in general and nursing home and long-term care facilities.
Absolutely. No, that's a wonderful point. I feel like a lot of these strategies are generalizable to any community who might be stressed during these interactions. Anyone who experiences some challenges with regard to interaction style in escalated situations. And certainly, yes, I think that we can apply these strategies pretty broadly in these cases.
Great. Adrian, who offered some resources that I posted in the chat,
yeah,
also suggested that POAC, which is a New Jersey organization, that they do have sensory communication kits available. Great. So people can reach out to them if they're looking for that resource.
Thank you, Adrian.
Yep, that's a great resource. We also have Dominique, who is sharing that they wanted to suggest making a QR code that links to your loved one's kit in home, medical information, communication needs, etc., that you could place on a dashboard or window of your car or medical ID. So that was a great suggestion also.
That's a wonderful suggestion, Dominique. Thank you.
It really is. And we do have a follow-up question to the question that you actually just answered in regards to a residential provider. So the question is, should it be the residential provider who contacts a community representative to meet with the residents? The residential provider is usually the nonprofit organization who owns, leases, or rents the group home. So I'm not sure if you have an answer for this. I do, if you don't.
Sure, yeah, I mean, absolutely. You can go ahead and I'll chime in as well too. No, thank you, Melanie.
Wonderful. So I think that's a conversation that the residential provider should have with the individuals that are living there, whose home it is. Also, if that individual has a guardian, please reach out to the guardian and involve them in that conversation while you're involving the people whose home that it is. I think you could come up with very many plans depending on what someone's comfortable with and the information that they're willing to share. And sharing some of the resources that were shared today, I think, is going to be really important, right? Some of the documents, what are some of the benefits of whether that's role play or just providing an introduction, what benefits would that provide for someone, and having those open discussions so that people can make those choices for themselves. And then let that be a collaborative effort, right? Between the individual, the group home, the provider agency, and the families alike to come up with a situation that's going to best serve everyone involved.
Absolutely. No, I agree 100%. And I do believe it is important for the provider to also be able to reach out in addition to the first responders, if not in advance of any of these discussions, to be able to begin to foster a very positive and open relationship and communication regarding, their needs, their services, and to ensure that the interactions in that event of a crisis are appropriately handled.
Great. Dr. Coleman, can you put up the last slide again?
I sure can.
Great. Someone was just asking to see that.
So sorry.
No, don't be sorry, not at all. And just as a reminder, everyone, I will quickly repost that link in the chat section. That will have all of the resources that Dr. Coleman shared during today's presentation. And then that way you also have a copy of today's PowerPoint.
And this will all be linked, but if there is any specific questions, my contact information is located there. I'd be happy to answer any questions, moving forward. If you're not able to find what you're looking for on the list of resources.
Wonderful. And I'm just pasting another resource that someone else shared, Robert shared. The resource, I just pasted a link in our chat section. Robert shared that this is a great tool for local OEM, like Office of Emergency Management, I'm assuming, and first responders to access critical information. This is a self-registry. So thank you again for that resource. I think that's great, right? When we have attendees sharing.
Absolutely. There's so much out there, really identifying and categorizing and making it easily accessible is also a big part of our job as providers, but I really thank everyone for their contributions to that. There is some really fabulous information out there, and making sure it makes it into the hands of where it's going to be best utilized is very important.
Absolutely. And it's not a one size fits all approach, right?
No,
so
not at all.
It's great. All the resources that you shared, pick and choose what's going to work for you, and whether it's yourself, someone that you support, someone that you love. I think there's so many resources out there that you'll be able to see what does and doesn't fit the needs of the individual that you're supporting. So thank you again. And then I saw that Colleen from CLEP just shared the PowerPoint again, the handouts in the chat section. So feel free, everyone, to copy and paste that link. And that way you'll have access to the handouts moving forward. So we're coming to an end. I see we're 7 minutes past. So thank you, everyone, for staying on. Dr. Coleman, thank you for giving your time today. The Community Living Education Project is really focused on offering presentations based on the needs of the community. So as we're saying goodbye today, you're going to see a brief survey pop up on your screen. Please take it. It's information that you provide to us. It allows us to better serve the community as a whole in the future with information sessions that are more relevant to your needs. Takes about 30 seconds. So if you'll do that, we would greatly appreciate. Keep an eye out for any additional emails coming from the Rutgers Community Living Education Project. We have multiple webinar series. I know Dr. Coleman's doing another session. I believe May 18th it is.
I believe so.
On executive functioning. The topic sounds really fascinating with some great information that's going to be shared. And we also have webinar series specific to self-direction and assistive technology. So again, keep an eye out for those emails from the Rutgers Community Living Education Project. So on behalf of Rutgers CLEP and Behavior Therapy Associates and Dr. Coleman, thank you so much for joining us today. And we look forward to seeing you at future sessions. Dr. Coleman, thank you again.
Thank you so much, Melanie.
Bye, everyone. Be well.
Bye-bye.